The Minister for Health, Honorable Kwabena Mintah Akandoh, has reaffirmed the government's commitment to completing the La General Hospital project, describing it as crucial to easing pressure on Ridge Hospital and other nearby health facilities. During a visit to the construction site in La, the minister was briefed by the contractors on the project's progress and the challenges hindering their work. Honorable Akandoh disclosed that government has already allocated 130 million cedis for the project and that the Ministry of Finance is fast-tracking the release of funds to avoid further delays. The minister urged the contractors to promptly report any challenges that could affect progress, noting that his ministry will continue to monitor the project closely to ensure it is completed on schedule.
The President of the Republic of Ghana is determined not to leave any ongoing project behind, especially in the health sector. And so, as you heard, the consultant and the contractor briefing us, this is costing us about 50 million euros. This project has gone through some history. The first arrangement didn't go through, and then they had to follow on a second alternative. So there is no reliable, or if you like, a dedicated source of funding. There are projects where you have loan or grant, or you have a specific source of funding. So as it stands now, this project, you'd have to make an allocation on the national budget before you get money to continue this project. There are projects when you inherit, there is a dedicated funding. So once you inherit, you just have to run with it. This is not the type of project. And so in 2025 budget, we made an allocation of 130 million Ghana cedis for this project. My records indicate that out of the 50 million euros, about 7 million euros has been paid, which means that we have about 43 million euros more to pay before the completion of this project. Our finance is committed into ensuring that funds are released for this project to progress. I am happy that today I've come to see the workers on site and they are willing to make progress until any payment is made. And so we'll continue to monitor keenly, and I'll have a special interest in this particular project. My responsibility as a minister of the sector to make sure that this progresses and is finally completed, to ensure they are also paid on time.
Accompanying the minister was the Member of Parliament for La Dadekotopon, Honorable Rita Naa Odoley Sowah, who expressed gratitude for the government's continued support and reassured residents of La that the project remains a top priority. Once completed, the 170-bed La General Hospital is expected to greatly improve healthcare delivery for residents in La and its neighboring communities, while also reducing congestion in major health facilities across Accra.
You can see that pillars are up, the project is ongoing, and so they are happy but hopeful that as we have promised, it's going to come on. And so today we are here with the Minister of Health to give them assurance double sure, because we followed up with the Ministry of Finance, and a lot of work is going in for payment to be made. You know, they do the work to a certain stage and then they raise certificates and then they are paid. So some of the certificates they've raised, payments will be made shortly to enable them continue the project. So I would say it's a happy new year for the good people of Dadekotopon, that at long last the NDC administration led by His Excellency John Dramani Mahama, who cares for the people, is going to complete this project.